Good afternoon. My name is Melissa Robinson, and I will be reporting on the association between BMI and sugar-sweetened beverage consumption. The burden of obesity in adults in the U.S. is a large public health issue. A person is classified as obese if they are 35 pounds overweight. Between 2015 to 2016, 93.3 million adults in the U.S. were considered obese. In 7 states, the adult obesity rate is above 35%. West Virginia has the highest obesity rate, currently at 38.1%. Obesity leads to an increase of high blood pressure, joint pain, high cholesterol, type 2 diabetes, gallbladder disease, heart disease, stroke, sleep apnea, and certain cancers. For U.S. adults ages 40 to 85, 18% die due to obese-related complications. Obesity also contributes to the economic burden in the U.S. Obesity leads to high healthcare costs and also impacts productivity and economic growth caused by lost days of work and disability. Direct costs related to obesity include costs that result from inpatient and outpatient medical services, along with labs, x-ray tests, and pharmacology. Indirect costs include lost wages, incomplete work along with higher life insurance premiums. Medical costs for obesity-related expenses are over $147 billion on an annual basis. Obesity is caused by diet choices, lack of physical activity, along with a person's specific environment. Socioeconomic status can have an impact on purchasing nutritious food versus cheaper processed foods. Poor nutritional quality leads to obesity, as certain nutritional needs are not met and substituted with unhealthy foods. The objective of this analysis is to determine if an association between sugar-sweetened beverage consumption and increased BMI exists. Methods. The data analysis included a subset of data restricted to residents in the state of New York and was created from a larger 2016 Behavior Risk Factor Surveillance System dataset. Analysis software used was Stata. Participants were interviewed via a random phone survey of New York adults 18 and over. The outcome variable included BMI and the consumption of sugar-sweetened beverages weekly. The data analysis included 9 covariates, including sex, age, ethnicity, race, education, income, physical activity level in the last 30 days, ever being diagnosed with heart disease or a cardiac event, and ever being diagnosed with diabetes. Data cleaning included creating specific variables of interest. BMI under 18.5 and over 40 were excluded. Weekly sugar-sweetened beverage variables were combined. The values of age were assessed. Race was collapsed into categories that included white, black, and other. Income was collapsed into 3 categories. 3 variables of cardiovascular disease were collapsed into ever told they had a heart attack, ever told they had heart disease, ever told they had a stroke. Methods of recording this variable was yes or no. The 3 cardiovascular variables were combined together to create a new variable, ever diagnosed with heart disease or cardiac event. Another variable was created to show if they had ever been told they had diabetes. Missing values were excluded. For the regression analysis, variables were adjusted using multiple linear regression, and confounding variables were removed in order to find a true relationship between BMI and SSB consumption. Regression models were run and the weighing variable was set. A crude regression and adjusted regression with covariates were run with the survey weighing, regressing BMI and SSB consumption. Assumptions for violations were checked using linear regression. Multiple linear regression was run, and then again to assess equal variance using complex survey weighing. Normality was assessed using a QQ plot. Each BMI category was assessed based on confounders and the dependent variable BMI. SSB consumption, physical activity level, income, and history of diabetes are significantly associated with BMI of adults living in New York State. A critical value of 0.05 was used in our analysis. Participants that were placed into the category obese were more likely to consume more than 7 sugar-sweetened beverages per week compared to participants categorized as having a normal BMI or overweight. Participants that consumed more than 7 SSB per week was 0.43 points more than a participant that did not drink any sugar-sweetened beverages per week. BMI for participants earning greater or equal to $50,000 is 0.26 points more than participants earning less than $25,000. Participants that did not participate in physical activity in the last 30 days was 0.73 more than participants that did not participate in physical activity in the last 30 days. The BMI of participants that had been diagnosed with diabetes was 2.4 points more than those participants that had never been diagnosed. The objective of the data analysis was to evaluate the association between BMI and sugar-sweetened beverage consumption among New York residents. Main findings showed a significant association between higher BMI and SSB consumption. Other factors that were associated with high BMI included income level, physical activity, and diabetes diagnosis. The public health significance is the rise of obesity and factors that influence reduction rates. Future research relating to the consumption of sugar-sweetened beverages and examining additional confounders relating to BMI could be considered. Interventions in New York City. New York City has tried multiple interventions to reduce SSB consumption beginning 2006. Mass media campaigns were launched to increase awareness and educate citizens on sugar consumption. Standards were established for beverages that were served in schools, hospitals, correctional facilities, senior centers, and shelters that require sugar-sweetened beverages to contain no more than 25 calories per 8 ounces. Proposals were made to introduce an excise tax on sweetened beverages and a cap on the size a beverage could be when served from a food establishment. From 2007 to 2013, a health survey showed a decrease in consumption of 1 or more SSB per day by New York City residents. Proposed research interventions could include behavioral interventions, community interventions, and policy interventions. Behavioral interventions could replace SSB with water, increased physical activity, specific goal setting, beverage logs, identify obstacles that prevent desired behavior from being achieved. Community interventions could include health and nutrition education, such as providing information regarding reducing SSB consumption and the health consequences of high SSB consumption, early intervention, such as school programs. Policy interventions could include a sugar tax. The target audience would include adults that consume sugar-sweetened beverages. A cross-sectional study design would be used in the form of surveys to see if the frequency of SSB consumption was reduced. A cross-sectional study is cost-effective and fairly easy to gain a quick snapshot of results. Thank you for your time.